Hello, everyone. I'm Dr. Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over um, National Mental Health Awareness Month, which happens to be May this month. And this has been observed since 1949. And the purpose is to reduce stigma, provide support, and educate the public. So this is led by major organizations like NAMI, which is one of the major organizations, and Mental Health America. So it's a month-long campaign, resources and community events that support the nearly 1 in 5 America adults living with mental illness. So let's go ahead and get started. So what are the key themes for 2026? One of them is from NAMI. The theme is turning silence into connection and sharing stories to spark healing, and also building community. These are three focuses for this year. The next thing that is a key theme and focus is Mental Health America, and I like this one saying is that more good days together. So having a good day is having a lucid day where there's no relapses or anything. And that highlights practical tools, community support, and actionable steps to improve mental illness. Next, what are the goals of Mental Health Awareness Month this year? Of course, reducing stigma is always important because there's always stigma around mental illness because it's not a tangible sort of disease, for instance, like diabetes or heart disease. So a lot of times this is underreported and people don't want to go to their doctor and share their stories and what is going on with their um, mental health. So reduce stigma, provide education, um, raising awareness of early warning signs, available treatments, and coping mechanisms. And these are very important because one without the other doesn't really exist. So you have to have early warning signs. You have to know available treatments and coping mechanisms. And then, more importantly, supporting communities. So creating supportive environments, and I was a part of this as well, one of them, and having a kind of a good group to go into, so that you know that you're not alone in suffering mental illness. So these are communities, even workplaces or community organizations are great. So how do you get involved? Use toolkits. SAMHSA provides a digital toolkit with social media content, graphics, and key messages. I'm going to be displaying some of these in LinkedIn this month. And then sharing personal stories that challenge stigma and on social media, often using the green ribbon symbol. So that's the symbol for mental health awareness. And then engage in events. If there are particular local events, webinars, or advocacy efforts to promote mental illness, go ahead and attend them. See what these are all about. I've done a lot of research in mental health, original research, and I can from personal testament say that these are areas that really need a lot more work. This past November in American Public Health Association conference, I presented with co-authors, I presented on diabetes and anxiety. Trying to manage diabetes on itself is very cumbersome, but when you try to combine diabetes and anxiety, this becomes way more complicated. And trying to manage diabetes in and of itself is very it can be very taxing. Um, so if you or someone you know is struggling, help is available through SAMHSA and other national resources. And if you get a chance, go ahead and call some of these places. Another really good place to call text line is or Seek Mental Health is crisis text line, which the phone number is 741-741, and you can text that or just call some of these 1-800 numbers to see what types of resources they have available, how they're helping the community. So, in summary, this is what Mental Health Awareness Month is pertaining to. I hope this has made some sense. Thank you for listening.